We are thrilled to kick off the first session of the day, the Pat Corley Keynote Speaker Session, Owning My Unique and Personalized Journey, featuring two extraordinary individuals. Our first speaker is Pat Corley. With over 40 years in patient care, Ms. Corley is a trailblazer in sickle cell nursing. Recognized by Dr. Cage Johnson for her tremendous contributions to national sickle cell care, she has been honored with the prestigious Elliot Vichinsky Award. Pat continues her impactful work with major nonprofits, carrying on her family's legacy of service to the community. Our second speaker is Sheila Marchbanks, a devoted sojourner whose life centers on family, faith, and service. Sheila is a retired aerospace executive who has spent nearly 13 years as a sickle cell disease ambassador, advocate, educator, and partner. As a senior sickle cell warrior, she brings both her professional expertise and personal passion to her advocacy work. Together, Pat and Sheila will lead us through today's insightful discussion on owning your unique and personalized journey. Let's dive right in. Thank you again for being part of this important event.
We're ready. Good morning, good morning, good morning. It's good to see all of your wonderful faces. How you guys enjoying this? Woo-hoo, me too. Me too. I'm learning something new too. We're just gonna try and share. And our presentation is gonna be really informal, you know. We're gonna be throwing things out and we may be asking you to respond to some of those things.
Absolutely.
So we're gonna start by Sheila. I'm just gonna tell you the story how I met Sheila. You know. Yeah. So Sheila, actually, I met Sheila. I was a young nurse. You heard him say I've been around for 40 years. I was a young nurse, and Sheila was pregnant. And Sheila was at an outside institution, different from my institution. I don't know how she found me, but she called me on the phone. And she said she needed to talk. And that was the beginning of our relationship.
Yes.
And I'm going to let her tell you about that.
Okay, then we're Pat and I are going to be going back and forth. We may throw some questions out to you and get your responses. We may even request you to pull up some information while we're speaking. Are you guys good with that? Y'all right now. So what I'm going to do is, first of all, I should share my name. I'm Sheila Marchbanks, as Pat Corley said, and I'm a mother of two, the wife of 46 years. Yes. And the grandmother of 7 beautiful, beautiful, joy-filled souls.
And I'm going to say I got one chick.
Yes, oh, yes.
One chick.
Yes,
Okay.
one chick.
And you guys have seen her around here because she's an interrupter. Okay. So Sheila, you want to tell the story about how we met?
Yes.
Yeah.
I really do. Now, Pat, I received Pat's name and number while she worked at USC, the rest of the hospital name. Okay. I cannot remember to this day who gave me the reference. But do you believe in angels? Come on now. I wonder, even to this day, I'm like, how? Because my memory is kind of good. That's one of the God's gifts for me. I cannot remember who referred me, but someone referred me to Pat. I was sitting in my office. At that time, I was working in contracts in aerospace, and I called this lady, and I said, "Hi, my name is Sheila Marchbanks, and I'm pregnant. This is my 3rd pregnancy. I've had no successful birth as of this time. I'm having some complications, and I was told to call you. Can you help me? We had never seen one another. This is a cold call. I didn't even have the insurance that her health provider had. I believe I had an HMO. I think I was with Kaiser or someone. And so Pat said yes. Has Pat said yes to any of you out here? Come on now, raise your hand high. She said yes, yes, yes. I'm telling you.
I do say no sometimes, though.
Oh, I'm glad I was on the yes side. So she said yes. And at that point, she sent me material. Do you want to go into? Okay. I Let me tell you a little bit about myself. Y'all know I shared that I grew up, I have sickle beta thal. And and because my diagnosis wasn't sickle cell anemia, there was a lot. I was suppressed as far as my disease status. When I would get sick, my family would say, "You shouldn't be sick. You don't have sickle cell anemia. Like, what are you doing?" So I learned to hide and deny my true self. And so I carried that on in my life. I would pursue life, get sick, do what I had to do as far as hospitalizations and care and rest and recovery. But then I would come right back out and deny. So I can literally say that I was a sickle cell warrior back in the day on the download. I did not let anyone know that I truly had this. Even some of my most intimate family members didn't know because I would hide it. And so I didn't have a lot of information. When I went into my career, I didn't want my employer to know either. So I kept that on the down low. So until I was 40, I'm going to go back and forth, until I was 45 years old, did I come out. And the primary reason that I came out was the beginning, the genesis was meeting Pat. She provided for me from that first phone call, the first NIH management, and this wasn't evidence-based back in the day. It was management of sickle cell disease. She mailed me an entire package, and it was the first time in my entire life that I ever received information outside of going in and out of a doctor's office. I took that little black book, which I still have to this day, Pat, almost 37 years later, and I took a pencil, a paper, a dictionary, because it was written for medical professionals like Pat and Dr. Cage Johnson. And I learned about me for the first time in my life. So because of the complications, I was taken off of work and I was put on bed rest for 3.5 months with a 24/7 monitor because of the complications. So look, the Lord gave me all that time to sit there and do back in the day, they didn't do homeschooling, but I homeschooled myself. So that's what I did. So Pat sent me the information. We didn't get a chance to meet each other face to face until,
oh my God,
5
years later. Yeah.
Yes.
Yeah.
It was literally,
Yeah.
my son was like 5 years, but we stayed in relationship on the phone. Do you all know how valuable relationships are? Yes. Are they priceless? Are they life-giving? Are they affirming? Are they joy-filled? Oh, come on now. Y'all saying it. Y'all saying, yeah, yeah, I like them, yes.
So I just want to know how many of you guys have relationships with your medical professionals or someone with sickle cell disease who has helped you. Good.
Can you shout
good.
out some of the
Just share with
relationships?
us. Share with us what kind of relationship and how did you get there? Because there are a lot of people who don't know how to get there. They don't know that that's even important.
I see Davita's hand. Okay. So,
Well, do it for the team. Do it for the team.
yes.
my relationship was with my doctor, Dr. Cal. Um, I've moved to San Bernardino County here in California, and my primary care doctor said, I'm gonna send you to a hematologist. Well, I skipped through about 2 or 3 of them. And then one came into the office one day and said, Oh, you're Davita. I wanted to meet you. You have sickle cell. He said, I'm a sickle cell doctor. I said, You're a who? He said, I'm a sickle cell doctor. I said, I didn't know they had those. He said, Well, I want you to come to my office. Gave me a date and time. And we were best of friends since then. I could walk in and say, Oh, this is going on, that's going on. He'll never look at me. He's on the computer. He go, Well, I'm not going to give you that, and I'm not going to let you do that, but I'm going to give you this and give you that. And then he'll look at me, Is that good with you? And if I say no, well, you got to tell me why. So then I do him back. Okay, so you're giving me what? Indari? For what? Okay, now tell me why. So we were really, really close. And just last month, he left Loma Linda University. So I have a new doctor coming. I don't know what that's going to be like.
That's beautiful. Davita, could you repeat his name, please, so we can honor him?
Dr. Cal, C-A-O.
Okay, beautiful. Thank you so much for sharing that, Davita. Dr. Kyle, yes, yes.
So is anybody else here who has a
One over there.
Wanda?
I have a really great hematologist, the one that I had for years, retired, and I'm like, oh Lord, what am I do now? So a new person was assigned, Dr. Sir Keith Reddy, absolutely wonderful, wonderful man. Whenever I've had an issue, he's always right there, gave me his cell phone number. Once I was squatting down, getting stuff out of the refrigerator, fell and lost my balance and my feet flew up. I was barefoot because I love going barefoot. At any rate, the refrigerator door hit my foot and I fractured a couple of my toes. And so I had an appointment with him. It was a Zoom appointment. And so he's asking me what's going on. And I just happened to mention my feet in passing. And he said, oh no, we need to have you go have an x-ray and find out what is in fact going on. And so he took time to do that because I was just, I probably bruised my foot. Yeah, it hurts. Just minimizing. But he's the kind of person that really, really takes time with you. I now have my husband seeing him. Everybody that I know, I refer because he takes time to explain things to you, and you can't ask for a better person than that.
So how many of you guys don't have that relationship?
Yeah, one more.
Okay. Yeah.
Say your name first, please.
Yes. Hello, everyone. My name is Nevia Charles. I'm from the Bay Area, California. I'm currently studying community development at Howard University, and I'm also a sickle cell warrior, type SS. I can answer both questions because I think that there's such a stark contrast. You guys are asking about having a good relationship versus a not so good one with your hematologist, correct? Okay, well, I always tell people that I consider myself spoiled because I came from Children's Hospital Oakland, where they take expert care of us. And my doctor, my favorite hematologist that I've ever had is Dr. Keith Corollo. Yes. Okay, let's give it up for Dr. Keith. Okay, thank you. You see, but just me mentioning his name gets such great response from people in this room because that's just how good he was. And it not just is his expertise, which he has a lot of. He'll talk to you for hours about all the things he knows if you ask him one question. But he also, what stands out to me is that he has heart-centered care. He is a very empathetic and caring man. And when you are dealing with people in a service capacity, whether you're a doctor, nurse, or what have you, you need to come from the heart when you're doing what you do. You could tell instantly that Dr. Carrillo cares about his patients. And it's almost like we're not his patients, we're family. That's my Dr. Q, okay? That I take ownership of that man. That is my Dr. Q. And I think that just makes such an impact and a difference, especially in the capacity where we are coming from an already hyper marginalized place. where Black people with disabilities, particularly sickle cell, a quote unquote invisible disability that people don't want to give attention to or funding to or care to the patients that are going through the things they're going through. So when you come from a space that's heart-centered and empathetic and you care, you can give us an overall better quality of life, not just from a medical aspect, but it helps to empower us. And I think that that's just such an amazing experience. And like I said, I'm spoiled, so I expect that wherever I go. But transitioning into adult care and also taking my care from the West Coast to the East Coast, like I mentioned, I go to Howard University. I haven't had the same experiences on the other side of the country, and I would assume, okay, like I know how to advocate for myself. I'm empowered. I'm knowledgeable on my condition. Regardless of the state of the clinic that I might go to, I'm willing to work with my hematologist to be able to craft the best and expert care for what I know I need. That's not always the case. I don't want to say any names or call anybody out on the mic, but I definitely think that there are a lot of improvements to be made in clinics across the nation. And I think that there needs to be a standard of care and just training for obviously all practitioners, but especially practitioners that address our needs and our concerns, because we are, like I said, coming from that marginalized place. So if y'all need some help, like whipping people into shape, I think y'all should call some of the people in this room and call on Dr. Q, because we need to get this standard of care universal.
So I'm gonna share something really amazing.
Yes, please.
The reason Dr. Keith is so good, because guess what he was before he became a doctor?
A nurse.
A nurse.
Yes.
Shout out to the nurses.
Shout out to the nurses.
We trained him well.
There was Felicia's hand. Dr. Hunt's hand is up.
Good morning, everybody. Well, I'm going to answer the second part. I did not know that it could be such difference of care. I used to go to Pomona Valley, and now I'm with UCLA. And when I got to UCLA, I found out I was mismanaged in my sickle cell. Dr. Patel found two things. Once after I had to be on dialysis with the hydroxyurea. I wasn't supposed to be taking it every day. My blood count kept dropping to like 4 dangerous numbers. I had to get more blood transfusions than I ever had before. And she was like, well, they mismanaged you because you should have only been taking hydroxyurea on the days that you had dialysis. And so I had to stop taking it. And then we did blood work. And then she implemented on the days that I had. And just now on September the 1st, I can take one every day. So it's like, I didn't know that. And then the other thing was when I went to get my eyes checked out, the eye doctor was so concerned that he called Dr. Patel. He thought, I guess I was about to go blind. I didn't even know it because the little vessels in your eyes with the retinopathy was like bleeding, just constantly, just blood. And he was like, y'all not managing her care. Like, so she called me back in and she was like, this doctor is upset with us because he talking about we're not managing your care. So there's things we needed to do. So I had to do laser surgery. And I had laser surgery before with Pomona. It was like zap, 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 zap. And it was done. When I went to this doctor, he was like, zap, zap, zap. I was in the chair like, this is intense.
Well, you got to realize that you're a bigger person and there's bigger vessels and there was more bleeding.
Yeah.
So they had to zap it a little
Yeah,
harder.
he had to zap it.
I
was like, oh, I can do laser. I had it before. Oh my God, not like that. But I'm glad to be where I am now.
Thank you so very much.
Okay.
So just share how it changes your outlook when you move from poor care to better care. Just think, those of you that have done that, do you feel like you're valued more? What's it like to have poor care and then have good care?
Well, Nurse Pat, I'll start. I'll
Okay.
start. This is the Oprah and Gail kind of thing going on up
Yes.
in here. um, I can tell you what it feels like to have great care. I currently am being seen by Dr. Osborne Blake at Kaiser's Sickle Cell Center of
We trained him.
Excellence.
We
And
trained
you,
him.
you know, I was dropping, you know, I was delivering it to her soft like that. Okay, yeah, yeah. And we being you and Dr. Cage Johnson and all, yes, wonderful legacy. To have good care is like going home. Y'all ever go to a homegoing service? And when you walk in the door, people hug you and say it's so good to see you. And it's like we know that food is not delivered in your medical center, but service is delivered in your medical service. So when I go with the excellent care, with compassionate and empathetic providers, they greet me like I'm a long lost family member. They ain't seen me since last July, but they may have just seen me 3 months ago. They greet me. They make sure that we hear the term whole medical home is provided. Not only do I see the doctor, I see the nurse. The social worker comes in to check to see how I'm doing. They'll say, go straight downstairs and get your meds before you leave. Go over there and take care of your x rays. When I'm in the room, I can tell you that Dr. Blake will literally take out his phone if he wants me to say exercise a little more. Okay. I'll be like, oh, I don't want to go to the gym, COVID. I have all my excuses. Oh, he don't let me stop there. He'll say, take your phone out, Sheila. He'll take out my phone, go to YouTube and literally tag, you know, you can save those spots where you can do this exercise. This takes time. He doesn't have to do this. I've never, ever been in a situation in which the doctor, the nurses, the social workers, the phlebotomists, the pharmacists, that they're all caring about my wraparound care before I leave that place. And they're cognizant also that I drive all the way from Rancho Cucamonga to get quality care, and it's worth the ride. So, what does it feel like? It feels good. I feel validated. I feel whole. I feel safe. And I feel that here I have been given the opportunity to experience a level of care so that when I work with Dr. Carolyn Raleigh, Pat Corley, and Adrian and the rest of the team, and we're developing programs and working on the planning committee and whatever, that I have a standard of care that is one of excellence. So therefore, that gives me the knowledge to be able to say, this is an expectation. And when I'm advocating for warriors, right, when you all call or text me and say something's going down, because of my lived experience, I can say, no, that's not right. This is what it should be. And when I speak with the medical providers, having that knowledge, when they know that you have the knowledge, it's a whole different situation. Okay. When I walk in and say, well, this is what should be done, this is the standard. Because otherwise, if someone establishes or tells you that C minus care is the best and you don't know any better, you will accept that. You will think, yeah, okay, y'all doing me like this is good. But when you have had A plus care, you know, no, no, no. You don't beat up, you don't attack, but you help that person to move from the position that they're in or their what they think is an A standard of care into a better place on behalf of the warriors, their families, their caregivers. And really, we spoke about the doctor yesterday, the nurse doctor that gave the presentation about all the other areas of life that are impacted. So you're also helping that individual's employer, because if we can get that warrior back to work healthy and whole, that's good for the whole world, really, because we have a lot to give, y'all. So we need to be strengthened up and healthied up and ready
Absolutely.
to go. We ain't trying to be sick.
Absolutely. Absolutely. So, so, you know, when I think about good care, I think about, and I don't have sickle cell. Okay. I think about care that I received once when I was younger at Kaiser Hospital. And I was there. I had surgery. And after the surgery, I had a trip planned to go to Brazil because I was going to Brazil to talk to the nurses in Brazil about sickle cell disease. And the doctor said, "You can't go." And I said, "I'm going." And she said, "But you just had surgery. You gotta carry suitcases. You gotta do." I said, "I have a few dollars. I'm gonna pay somebody to carry them suitcases, but I'm going." And she said, "But it's way across the world." And I said, "But I'm going." And she said, "Well, you have to promise me you're not gonna lift anything." I said, "Okay, I can promise that." And I can tell you, for a doctor to feel like I was valuable enough to say that you cannot, even though I'm sure she knew that what she said didn't matter to me. But the fact that she cared enough, and that's what I want for all of you guys, someone who cares. You know, when you're making poor decisions, as people with sickle cell disease sometimes do, when you're making a decision that is not based on your best interest, I want that doctor to say to you, "That doesn't sound like a sound decision to me." So how about we think about it differently? And I want you to be able to say, "This person cares about me," you know, and I'm going to think about that, because I think it's really, really important. And oftentimes we just get mad. It's like, "How are you going to tell me what to do?" you know, rather than really processing that maybe this person is saying this because they know that outcomes may not always come out the way you think they're going to come out. And so the other thing that I want you to know is that you have the right to select the person who best fits what you consider a person that cares about you and that will go to bat for you. Because you need someone when you're in the muddy waters of sickle cell in institutions to go to bat for you. And so what does that mean? That means talking to that person and finding out who they are. It's basically vetting the person. Yes. Are you worthy of taking care of me? They may be thinking, "Do I want to take care of them?" But your thought should be, "Is this person worthy? Do they have the equipment they need to take care of me? Do they have the support, that needs to be present as they take care of me? And do they have the desire that even when I show up in the wrong way, that they can speak with me and help me to work through that so that I can then be able to talk with them and trust them to have my best interest at heart." So I don't know. And, I know that's a really difficult task, but, you know how we talk about build a bear? Build your doctor, okay? If your doctor has characteristics that you think will work for you, give them the other things they need to make that work for you. I think oftentimes we get mad at docs and stuff. We don't say we mad, we just leave. That is not the answer. And then in their head, sickle cell people are this way. They got hot tempers. They don't want to listen. What we want you to do is to learn how to really, ask those questions that put you in a position to make good decisions about who's going to provide you health care. And if it don't work, guess what? You don't have to be mad about it. You just say, "This is not working for me. So I'm gonna look around and see if I can find that person that can provide the kind of care that I need." And it doesn't mean a person that gives you all the medicine you want. It's a person who cares enough to say that this is not working for you, who says to you, "What has worked for you in the past?" And I think it's so, so, so important for us to teach. If we don't teach people with sickle cell disease anything else, we need to teach communication. How do you communicate? How do you communicate with your family? How do you communicate with your loved one? How do you communicate with your doctor? How do you communicate with institutions? How do you let them know when they're not meeting your requirements? You don't just blow up and cuss everybody out. That ain't the way. Because guess what? What does it afford you? Avoidance. People don't want to deal with you. So the reality is to, like build a bear, build your doctor, build your system, identify what works for you, what does not work for you. Well, there may be things that everything's not going to be in line, but what is your point that you can no longer tolerate the situation you're in, that you are not willing to work on? And those are the kind of things that you really, as a person, being a nurse in the system for a very long time, and fighting a lot for people with sickle cell disease. Sometimes you guys make me mad, okay? Because sometimes you make it so hard for me to ensure that you get what you need. I'm just keeping it real, and I'm sure sometimes when you think about it, you're like, I don't know why I did that. But I think it's important for us to say that we love you guys. We want to support you. We want to lift you. We want to make sure that you get everything you can get. But you got to help us because we out there fighting for you.
Yes.
Okay?
Yes. And you know what? That was so well said. We're all here warriors fighting for one another to get the best quality of life. And our theme is unpacking sickle cell one warrior at a time. And when we look at our graphic there, look at what we have to unpack. Our next segment is going to be on. Our next segment will be on how did you unpack hospital stay issues? We have to unpack that. That's a reality for many of us. Pardon me. How do you unpack management of pain? It's in our bags. It's like, oh, anybody got a bag up in here? You know those wonderful bags that Cayenne Wellness put together, stacked full of stuff? I mean, products and materials. Well, in our lives, we carry bags. We carry some luggage. Sickle cell warriors, non-warriors, supporters, doctors, providers, all of us are carrying baggage. What if you have a child? How have you unpacked producing, creating, coordinating with the educational system, a 504 plan or an IEP plan, and knowing the difference between the two? Okay, because there's a difference. Then how do we unpack, oh my God, the huge elephant that pervades not only the care of people of color with sickle cell, but people of color, period, implicit bias. And can we keep it real? Explicit. Sometimes, folk just be straight up in your face with it. They ain't even trying to be, subtle with it. And then career setbacks. My goodness gracious. Many of us may have had health issues, operations, and other dynamics that impact our careers, where we may not even be able to drive, let alone go to work on a regular and be consistent. Then warriors, supporters, family members, providers, we also want you to tell us a little bit about what has it been like unpacking organ damage, right? Sickle cell is a blood disease, as we all know, and blood flows through the entire body. In blood, there's life. And when there's a blockage of blood, there's necrosis or there's death, slow or sudden. So how have you unpacked the organ damage and how has that impacted your life? And how have you been victorious over it? I'll give you a short clip with me. I have dealt with AVN since I was 20 years old and it was progressive, bilateral. But I ignored it and I would get some cortisone shots. I put the heating pad on. I did everything, didn't I, Pat? I did everything.
Yes. Yes. I'm going to tell on her now. we were at a national meeting in Washington, D.C., and she was talking to me about her hip. Well, you know, I'm one of those kind of people that call you out, okay? I'll just call you out. I came from a family of 11 children. I will call you out because a closed mouth don't get fed, okay? And I said to her, well, just like I did to somebody else in this room, you must be all right with that. Because if you get your hip fixed, you're gonna be running around and nobody gonna know you the same Sheila, you know. And she was like, well, I think I'm gonna wait a little while. I said, okay, you like pain. You like pain, you know. So what did you do?
Well, I came back. I took medicine every day to put my foot down on the ground. The pain had gotten so bad. The surgeon, when he told my husband when he went in, they said they don't know how I lived with the pain and the death of the bone and the inflammation. If I had to get up to go potty before I could even go, I couldn't put my foot on the ground before having help. And you know, there's a distinct difference between addiction and dependent. I was just dependent on getting some help because as soon after I got my hip replacement, I didn't want that medicine. It was repugnant to me. It's like yuck. But what did I do? I came home. I didn't immediately get my hip replaced. But yes, I did get my hip replaced in 2016, and I've never looked back. Y'all saw me dancing last night. It was the best decision I could have ever made. Got to the point that I asked myself, why did I wait so long? Why did I wait so long? I can tell you one reason: fear. Fear. Has fear ever paralyzed you, stopped you in your tracks, made you decide that whatever the situation you was in, it was the best situation that you can be in and that it ain't gonna get no better? So you learn to tolerate that and make adjustments for that and deal with that pain. And as Dr. Hunt shared, sometimes the pain ain't even physical. Y'all see me using ain't, I'm doing that on purpose. I know proper English. Okay. That the pain is not even just physical. It could be mental, emotional, psychological. Have you been in situations that you've just endured pain?
Of course, all of us.
Yes.
All of us. I don't want to go to the doctor because I don't want to find out anything. They done told me enough.
Yes.
I don't want to know no more. Okay. So I'm not going to the doctor, you know, and I'm only going to the doctor if I have to go to the doctor. And that's because I can't get up and walk and do the stuff I want to do. How many of you guys have experienced that? I'm not talking to that doctor unless I have to, because they're going to find something else. You know,
Exactly.
that's where we are.
That's
okay.
where we are. I would love to hear from Felica. Raised her hand, and a couple more. I see you, sweetness, back there.
And while we waiting for you to get to the mic,
yeah.
there's one thing and I'm my committee. There's one thing we left off of this.
Okay.
You know, we didn't have a big enough bag for, and that topic is family relationships.
Oh, yeah.
We don't have a bag on anybody's back that suggests that exists. But how many of us know that exists?
I think the bag is like,
it don't fit in none of those.
It's on everybody's back. How about that? It's literally unpacking that.
What you want some kind of, you want a big old tent or something?
Yeah,
all of them?
absolutely. Yes. You know, at the beach when you have those little tents, right?
Okay, we got to put the tent.
We got to put the
Next
tent.
time.
There we go.
Okay.
Felica.
All right here. Hi, guys. My name is Felica. I'm a mother of a son with sickle cell SC. And I got to say that I told my son about the good adventures that happened this weekend. And he said, Mom, I'm going to go with you next time. So that's my good thing. But I put off getting knee surgery because I was scared of the fear. And then plus, every time I start going near it, my son ended up having a crisis. So I'm like, what happens if I have a crisis when I get my knee repaired? But I got both of my knees repaired. This one 2 years ago, a total knee replacement. This one just past March. And the doctor said, you're walking good, no cane, no nothing. But I put it off because I was in fear. And then, I just didn't want to, I was scared. So, yeah.
So did you dance last night?
I actually had to do something else. So, but I do dance. I am trying to skate more. I couldn't garden because, get on the ground. So my goal this fall is to garden and actually be in the garden on my knees and get up by myself and all the good stuff.
Somebody else had a hand up.
Somebody else did, and I'll take it to him. But remember, we have some people online also that are asking questions.
We'll take them.
All right, Dominique, please ask the question.
Hello. Our first question is regard to Miss Pat and what you said earlier about the doctors. One of our virtual people said, if they are not able to find a doctor where they could build that relationship with, because there's no hematologist that's in their state that will see sickle cell patient, what should the patient do?
So the reality is that it doesn't have to be a hematologist. It can be a family practice doctor. And that family practice doctor can have a relationship with a hematologist who can guide them. So it doesn't have to be a hematologist. I think everybody thinks they have to have a hematologist. Certainly that doctor should send you to a hematologist periodically so that they can stay on course, but you do not have to have someone that's a hematologist that you call your doctor, your only doctor. I would say to just find you a good family practice doctor who cares about you, who will be vested in you, and who is willing to reach out, to others and to listen. Make sure you don't find a doctor who thinks that you are questioning their ability, because sometimes doctors will do that. They will feel like I'm telling you everything, I'm giving you everything. And what you want to make them understand is that you truly want a team working together. You're difficult because you have sickle cell disease, and sickle cell disease can show up at any time in any different way, and so you want to ensure that you have all of those things in place that will make him or her be as successful as they can be with taking care of you as a person who is uniquely positioned with sickle cell disease.
Okay, do we have time enough for another virtual question?
Yes.
This person said, I just transitioned and I went from pediatric to adult care, and in pediatric, I had the best care in the world. The doctor listened to me and everything. But going into adult care, things are a little different. How do I get my doctor to listen to me, because I know my body, and instead of just going based off of what he knows, especially if he's been doing it for a long time?
So I think you have to have those conversations with doctors, and I think you have to share that you're a team, number one, and that no decision made about you should be made without you. And to say that the reason that I'm here is that I believe that you can provide me good care. And then to kind of lead those conversations always with the fact that, you're the doctor, but I'm the person with lived experiences. And so I need you to be open to me sharing, and I may not always tell you something that may be perfectly correct, but I need you to almost like vet what I say as I vet what you say to me, and together, if we're working united together, we can make a difference. I want to have the best life I can with sickle cell disease, but I need your help to do it. And I think sometimes we as individuals go in and we just are at the mercy of the doctor. I think you have to take your power. You have to use your power, and you have to make sure that people understand that this is my life and it's important to me. And I know there may be missteps, but I want to somehow avoid as many missteps as I can. And then the other thing I want you to say, because you said that you had great care as a pediatric patient. And yes, you do. Your body is new. Okay, it's a brand new body. So that doctor is not dealing with all the things that that the doctor later on has to deal with. You don't have avascular necrosis in most instances. You don't have all the symptoms. You have not had the experience with pain. You have not had a lot of the experiences you have with the healthcare providers and settings. And so the way you look at that care is not going to be the way you can look at adult care. Adult care is not warm and fuzzy like pediatric care. It's get in there, do what you need to do, make sure that you're as well as I can keep you, and keep it moving. I'm just being real. So I, as an adult provider, have real issues with doctors who I hear pediatricians who say, we took really good care of people with sickle cell disease and then they became adults and they died. They died because of sickle cell disease and the damage that it does to organs and things. And so grounded in reality is, as you have more insult to your body, you're going to have more damage, and so if you can stay positive and actually bless that doctor who's trying to take care of you by saying, I realize that you're trying hard to take care of me. I know sickle cell disease is no respecter of man. It's not a warm and fuzzy disease. And so I want you to do all that you can do to ensure that I live as long and have as good a life as possible. But I understand that you have some limits as well. Okay. And I think that's really important to share, because we as adult providers, our feelings get hurt. Okay. We're doing everything we can for you, and you telling us we trying to kill you because that's what your pediatric doctor told you, that we don't take good care of you. Know that adult providers care. Sometimes they're limited to what they can do. Sometimes they don't know what to do, So just as you want grace, give them grace.
Miss Pat?
Yes.
I just want to say something before you go to the in-person people. That the last thing you say about giving the doctors grace and showing appreciation to the doctors, one thing I realized as after I got out of pediatric care and went into adult care, how hard it is for adult care providers, especially if they're in a field like cancer and sickle cell patients, how hard it is for them to deal with everything that they have to deal with. Whether they're losing patients, they feel hopelessness for not helping patients. And I took that and I realized that one day because my doctor came and she was really upset because she had lost a patient. And I realized, like, oh, wow, they go through so much also, and they care also. They need appreciation too. So I started doing it. I make sure that I show my doctors appreciations. So birthday gifts, Father's Day gifts, Mother's Day gifts, just the doctor's appreciation, nurses appreciation week, just little things, because they really can't accept anything big, but like a slice of cake on their birthday. Hey, happy birthday, some balloons or a card or something, just to show appreciation. And and it makes a world of difference.
It absolutely does. So one of the things we used to do for the nurses at our institution, and it came about because of a chaplain. Chaplain services are necessary. Utilize them. They will fight for you. The chaplain came to me and he said, how about we do tea for the nurses? As a sickle cell project, and we let them know that we see what they're doing. We understand what they're going through. And I think sometimes we don't think through things like that, but it made a big difference. We would push this cart around with tea for the nurses, and we would let them know what time we were coming to their unit, and we served tea for their nurses. And it's those kind of things that make a difference. And you guys can start projects like that from the community as people living with sickle cell disease, going back saying, we see you, we appreciate you, know that we know that you care, even on those days where you're so hard work that you don't have time to spend with us, And so if you leave with nothing else, leave this setting knowing that you can make a difference in how people perceive you, how they respond to you, because that idea that all sickle cell people with sickle cell are the same, you got to show them that don't really exist. You know, that's in their heads, but it'll stay there if you don't do something to alter it. Sheila, I've taken up all the time, so I'm going.
I think that you're because you have that perspective, you know, as a professional nurse as well as an advocate for patients. Your comments were absolutely complete. All I can do is just put a teeny lady cherry on top, and that is that our providers are human, and we have to remember that they're not omniscient. They are not all knowing like God. If we go and expecting them to know everything about this rare disease, and each of us presenting with our own individual set of complications and issues, I've never heard of two sickle cell warriors presenting or having exactly the same dynamics. So can you imagine a doctor dealing with a rare disease? He's and she, they're human. They don't know everything. But if we go in with that expectation because they're a doctor, right? Because that's kind of how society, oh, they're a doctor, they know everything. They don't. And what Pat said is that we're to partner with them. And that grace goes a long way. And I'm going to use another word, mercy. Sometimes people make mistakes and we don't give them what they might should get or deserve. We have to step back a little bit and say, you know what, I'm gonna have mercy on this situation. Who knows with this doctor, someone mentioned a doctor may have lost somebody. They're dealing with their human dynamics and their families, their health, their colleagues, the politics at work. So it's not to give an excuse, but it's to walk in as a fellow human being and to partner and appreciate. And you know, we've spoken about how we will go to the ombudsman if there's something that goes wrong and document that. Let me tell you also, as Ms. Wanda has said, you go and you write up those good things. You give, you say, cheers, this doctor, this nurse, this phlebotomist, it could be anyone. You write a note, you identify them by name, you make sure that not only does the ombudsman get it, but you make sure that the head person on the floor gets it. You make sure and this is what I do, I will CC the person I'm writing about because I want them to hear directly from me about how much I appreciate them. And so building those relationships, again, relationships are golden, they're priceless.
And they're absolutely necessary because when somebody says something about you as an individual with sickle cell disease in the midst of a group of other folks, if you have that person who you're partnering with, they're going to say, well, that's not the experience I had with them. You know, so maybe it's just a bad day for them. And maybe it was something. Have you really looked at what happened? Maybe it was something that you said that triggered them. You know, that's not the experience I've had. I don't know if you guys remember the chaplain last night who said the prayer for us before dinner. That is the chaplain that when I first started out working at the hospital, he was just a general chaplain. But with talking with him, he decided people with sickle cell disease need prayer when they're in the hospital. And he and another young man, Calvin Moore, who's now no longer with us, started a whole movement within the institution that changed how the chaplains felt about people with sickle cell disease and ultimately changed the way the nurses felt because they interacted with the nurses. So you guys are more powerful than you think you are. Create things, create badges that we love this nurse. She takes good care of people with sickle cell disease. Make that nurse stand out. Do the things that you can do to bring people to your, you know, to stand beside you and to support you and to realize that though you are having some difficult times and though you're struggling right now, this is not my existence. I want to get better so I can live my best life with sickle cell disease. And you are a partner in this.
You made me think about when Pat said about the badges, do badges or the tea. I happen to have fruit trees in my backyard, and some years, you all know, sometimes there's just a plethora of lemons. I mean, and pomegranates, things like that. They're expensive now. And so if I know I have a regular, like I'm not in a crisis, I don't need urgent care or emergency care,
Yes.
I'm just going in for well care because guess what? I know we are all more than just sickle cell. We go in for typical routine appointments and say you're going in, you're feeling pretty good. But you're just going in for your annual exam. And you have the mind, you have the time, you can plan. My husband and I will go out and pick an entire basket full of lemons and we take it down to the staff. And you should see how, like, I mean, like children, we all love gifts. And the lemons are like, what, $1 a piece? They are so happy. And it's a small gesture. It's something, it's a resource we already have. It's a resource that we've nurtured and loved. So it's an exchange of love. We give from our hearts.
But it's also an acknowledgement that I see you and I appreciate you. You know, and so I want to give you something back, you know, and it makes people feel so good about you when you do those kind of things. I can remember people coming in bringing me stuff, you know, and I was like, you don't have to do this. And they would be like, well, but I want to because of what you do for me, you know. So I just want you to say that you have control over some things, but you have to go back when you're well. When you're in the bed yelling and screaming, nobody knows who you are. You know, go back when you're well. Let them see you when you're well. That way, when they see you when you're sick, they'll want to see you when you're well. Okay? Those are the kind of things that you as sickle cell, you have control. You know, you can utilize that control to make things better for you, or you cannot realize your power. You know, you can decide that you want to be that person that, you know, makes everybody feel sorry for you rather than them seeing your reality. You know, because if you up there fussing with the nurses and doctors, guess what? You're probably a strong person. Come back and show them your strengths. You know, let them know who you are. When you come in the hospital, I know you can't talk much to folks. Once you're better, tell them who you are. You know who you are, know what value you have. I'm going to teach you how to take better care of other people with sickle cell disease. You know, take your power, you know, and with that power, do things that elevate people with sickle cell. Do things that educate people about sickle cell. Do things that acknowledge how valuable you are as a healthcare provider to us with sickle cell disease. You can make a difference. You can make a difference. Make that difference. Be that vehicle of change.
Thank you. The gentleman here with his hand up, could a microphone be given to him? Thank you, Felika.
Hello, Nurse Pat. I just wanted to say that
Share
I
your
thank
name,
you.
please. Share your name.
Oh, my name is Noah, and I'm from the Bay Area. And I just want to thank you for empowering us. I had a specific question about the method in which you advocate. There's a time I had a crisis in the city that I was not from, and was having horrible care. And Nurse Pat was able to get the care that I needed so that I could get home and get to my family and things like that. And so I was just curious as to, was there a specific strategy and a way that you advocate so that we could break down some of those barriers when we're in places that don't want to treat us?
So it's easier for me to do than you because my introduction is I am, and this is what I've done in the past. And that kind of opens some doors or it closes some doors. But I think just to tell them, just, you know, all of you guys know how you live with sickle cell disease. You all know how often you may be admitted to the hospital. You know, all know how long you generally stay in the hospital. But all of those kind of things, what works for you, what doesn't work for you, you need to compile that information and be able to present it in a way that people will listen to you. Yelling and screaming and being mad does not benefit you, you know? And then you need to know how those systems work. So how many of you guys know if you run into problems, who you can go to within the system to get help? Know your system. Make friends with higher ups. Go visit the CEO of the hospital. You know, I'm a person living with sickle cell disease, and your hospital is where I've chosen to get my care. So that when you have bad experiences, guess who you have the ear of? You got the ear of the CEO. But those are the kind of things that you have to do. A group of you can go to see the CEO and say, you know, we receive our care here, and we want to inform you that we're here and that we want good care and that we want to be able to utilize your facility. And these are the things we need as people with sickle cell disease, you know, and get that person on your side, because the more allies you have, the more likely you are to be successful with anything that goes down in that system. And then also get to know your legislators. So you can go to your legislators and report what goes on in institutions that live in your, you know, live in that arena where that hospital is and where. So I think we have to do a lot more work on what the things that you guys can do and how you can make a difference, and how important advocacy is, access to advocacy and other organizations that offer you. And my biggest pet peeve is when you guys come in the hospital and you're gonna advocate for yourself. You broke down at that point, you in so much pain, and you gonna fight somebody? How's that working for you? So I say to you, find someone who can speak for you at times when you can't speak for yourself, and respect that person. Make sure it's a person who speaks in the way you think they should speak about you and who really knows you. If you find somebody that you think might be good, make sure they know you, you know, and utilize them, you know, utilize the systems that are in place that can advocate for you, that know the things to say. There are certain phrases that advocates say that open doors that you can open for yourself. So I know I only have a couple of minutes, and I'm gonna let Sheila finish with that, and we'll come back another time if you guys like us enough to bring us back.
Okay.
We will come back another time if you like us enough to bring
Yes.
us back.
Yeah.
You know.
See, she keeps recruiting me. Noah, and everyone else, I would like to also.
You owe me.
Well, she keeps saying I'm still in, you know,
I'm not
I'm still in
recruiting.
Hawk.
I'm recruiting. She never gonna be able to pay me back because I didn't tell her how much it cost.
She did not tell me when we met some 37 years ago. But it's been worth it. I've been paying my dues. Have I been paying my dues?
Yes.
Okay, all right. The interest is high though, I'm telling you.
Yeah. It's like buying a house.
No, and the rest of you, one thing that I would also like to share is you were sharing with him on how to get in contact with the CEO and making relationships. This hit me. You know, hospitals and healthcare facilities have health fairs. Most of them do. They have like little health fairs and outreaches. As a warrior, as CBOs, there's a lot of CBOs also represented in this room. Go to the hospital and speak with that CBO and say, we would like to have a table for sickle cell awareness. We would like to volunteer. Show up and serve a little bit, because while you're setting up your table and you're sharing with people, boom, you're going to meet the head of nursing and different departments. They're going to see your face. They're going to see you well. They're going to see you as intelligent, empowered, educated people whom are loving and providing information to the community. I just, health fairs are such a great place to interact with people, to learn about other modalities also, and to let the hospital know you're just not here to receive, but also to give. And when we give, we always receive so, so, so much more back than we ever gave. And it's just a joy to give and to share. So if in your communities, or get with Dr. Raleigh and we can get you some flyers so that when you're at your different health fairs, you could represent. There's educational information. Perhaps even you can ask the hospital during their health fair, do you mind having some sickle cell testing?
Yes.
Having the little lab there, the people take the blood and then give the report, because many, I think we've talked about this a little bit, many times that a baby is born with trade. And in California, my knowledge is that sickle cell trait is reported. But the traits, as far as I know, both of my children are beta thal minor. Okay. I didn't receive letters. Now, it was right at the precipice of reporting, but I don't believe that letters are presented to parents if their baby is born with beta thal minor. I love my sister Norda over there. She's given it because this is my passion. Since I live with sickle beta thal, we need more education on the other alphabet traits. We need more education on.
But just keeping it real, the people with sickle cell trait don't get their information.
True that. Okay.
Okay.
So with sickle cell trait, sometimes they don't. That's important, right? Or if the parents even know, sometimes, as Farron has said, it's just put in a drawer and then, you're like, oh, just trade, my kid's fine. And in addition to that, we need beta thal minor to be reported, C, D, E, O Arab, and all the rest of them. Those are the top 6. Because there are many of us that are in this room that may even carry those traits and don't know it. So my thing is if we get involved and we start advocating and we start serving and we show up when we're feeling well to support these institutions, you better believe the relationships that are built are priceless.
And volunteer services at the hospitals. Plop yourself down in the middle of volunteer services. And as you're volunteering, everybody else gonna know about you. Because when they go to the meetings, they're gonna say, I have a person with sickle cell who volunteers. Yes, absolutely. I mean, it's about creating, those opportunities to not just elevate yourself, but to teach others about sickle cell, and the things that people with sickle cell disease experience, how they feel, how they've been traditionally mistreated, and how you are there because you want to have a presence and ensure that you guys know who we are out here with sickle cell disease. Look at me, in spite of all that I'm going through, I'm out here and I'm available to you.
Right.
I can teach you about sickle cell disease and life more abundantly.
Yes. So in our final minutes together, it seemed like the time went by so quickly.
It did.
I know, we were
And it's funny because when Sheila and I talked about it, we were like, what are we gonna do?
That's a long time.
That's a long time. And guess what? You got the biggest talkers of all up here on the stage. And I acknowledge I'm one of them.
And lover of people.
I'm one of them. Who's the other one?
The other one is right here. So
hopefully,
we both said so together.
hopefully what we've given you will make you feel more empowered to take your baton. We're gonna make y'all track stars. Take your baton, but only run the short races, not the marathons and stuff. You do the 100-yard dash and get there and make a difference for not just you with sickle cell disease, but for your sisters and brothers with sickle cell disease, and for And help us too, because they beat us up too when we're advocating for you. Huh,
Exactly.
Adrian? Do we get beat up? But it just makes us stronger.
So in summary, I would like one of you to stand up and share with us, what did you get out of this session? How can you apply it to your lives and make your lives better? I see all these hands flying up. You know, it's too many to choose from. Okay, gentleman in the back, Falika right beside you.
Hello,
Hello.
Hi.
my name is Muiwa. I came from Durham, North Carolina. During this session, I learned that there are people just like me, you know, in the world, in the country. I really enjoyed the Golden Warriors. That was what made the biggest impact to me this weekend. And I will tell you guys just like this. Growing up, because I'm 39, I'm gonna be 40 this year. Growing up, thank you. Growing up, I've always been fearful of the unknown, fearful of when is my time, when is it going to be my time. I don't know if anybody watched the Avengers movies here. I used to wonder which Avenger movie was going to be my last, because I was such a big fan. It was going to be Iron Man 2. If it was going to be this movie, I didn't know which one. It's like I gotta watch them all, but when am I not going to be here to be able to watch the next one? But seeing the Golden Warriors has been very important to me, and I really, really appreciate being able to make it here, being able to meet all of you guys, and thank you for having me.
Thank you. Thank you for coming almost 3,000 miles to join us. I see the gentleman here. And please share your name when you speak, okay?
Good morning, everyone. My name is Scott Solis. I came with my twin brother, Steve Solis. We came from Florida, Orlando, Florida. One thing that I've really taken away from today's session is that the part when you spoke about not being angry in the hospitals, I feel like that's very important because, I'm a content creator for the sickle cell space. And one of the videos that I created was about not being angry in the hospitals. And surprisingly, well, not really, but I got a lot of pushback about that. Oh, it's the doctor's fault. They're not treating us right. We're not getting the proper treatment, which some cases that is true. But at the same time, I try to explain, what does that get you? So I feel like that message is very important because, once you push back and you have, some sort of feeling towards the system, you're not going to get what you properly deserve, which is proper treatment. So, I definitely want to continue that message and carry that everywhere we go.
So does that not relinquish your control when you get angry and
Right.
you have no control over the situation?
Exactly.
You give them your power.
Exactly.
So don't do that. Don't give anyone else your power.
I agree. 100%.
Thank you for coming all the way from Florida. And we would like to get the information on your social media, whatever you have, explaining how not to be angry. And hopefully this session has helped you to provide input to individuals who may push back and still want to blame the doctors, where you can provide more information to open up their minds so that they can obtain better care. Thank you both for being here.
So we only have 2 minutes. I keep seeing the sign.
I was ignoring it. No, I wasn't. I really. we can do the after party, okay?
Yes. Because we respect our leader, we're gonna only take 2 more minutes. But if it was anybody else, guess what? We take as long as we want. Any other questions here? Any other share here?
I see Brother Farron standing.
Wait, do we want Farron to say anything?
He gonna do a 30-second like he did
scary.
yesterday. I know it is.
Scary.
It's but we're in a time limit.
You're gonna take up all my time.
You better be nice to us because we know where you live.
Thank you. No, I just want to say, as Sheila was saying about that human being part of that, right? I'm a trait carrier. And when I came in this community, it's like, well, you don't have the disease, you don't know, right? There's a part of us that are human beings first. And that relatedness is so important. As a veteran, I inherited a lot of conversations about the VA is not going to take care of you, like a lot of talk about that. And it took me a while to go to the VA. But I gave my doctor grace when I found out he had 1,500 patients.
Yes.
I was like, well, no wonder I can't get in here. And it really changed my perspective of how I felt about him and talked about him and then even treated him. So
Absolutely.
that human being connection is very important. And a lot of times we discount our experience because we've been hurt, we've been disappointed with people, even our family. But I don't understand myself. So why would I put that pressure on you to understand me?
Yeah.
But the relatedness is so important.
And how about leading that conversation with, I know that you may have had a difficult time today, you know, and then leading into your conversation. And sometimes I'm difficult. So let me just share what I need from you. How about leading the conversation? I think sometimes we don't understand, if we lead the conversation, we got the control. Okay? If we let the other person come in and they're just talking at us, what kind of control do we have? We have no control. So I think it is so very important for you to say sometimes, I know you're probably really tired, but let me just take a few minutes and tell you what's going on with me, because that gives that person the opportunity to say, yeah, it's been a really difficult day, but I'm going to do the best I can do for you.
Okay, I think it's time to wrap. I want to thank my, Adrian. Adrian got something. We can close with Adrian. Yeah.
I just want to say, Access is kicking off its next advocacy course. If you want to learn these tips and techniques, and there's many of you already in that have completed the course, we have the QR code, and I'm just so thrilled to be here.
Fantastic. I want to thank you, Pat, and I want to thank you all for being a phenomenal audience. This has been a phenomenal week, and we pray that what we've shared can help, can encourage, can inspire, because you guys inspire us. Pat?
And I'm glad it's over with. But let me say that, because I didn't know what I was going to do when I got up here. I'm just keeping it real. But I just really want you guys to understand that you have value. You have value. You mean the world to many of us. You guys made me who I am, okay? I am who I am because of all of you that sit in this room and all the warriors that I knew who are no longer here with us. And so I applaud you. I would not want to be in your shoes. I don't want sickle cell, but I know that God gives his biggest burdens to those who he believes can handle them. You are God's folks,
Yes,
and you're going to make a difference in this world. And I just thank you for your ability to stay focused, and to live your life in the way you're living it. And I can't categorize how you live in it, whatever way you live in it, be a part of making a difference in the sickle cell community.
Let's stand up and applaud these beautiful people.
Woo-hoo. We celebrate you, and this is not a job for me. I'm a volunteer. So thanks for letting me volunteer.